We continue now with our ongoing series answering your questions about COVID-19.
The Fox 12 investigators went to the experts to dig a little deeper on questions that you didn't have answers to. And Simon Gutierrez is live in Northeast Portland tonight with the next installment. Simon?
Now, this one is about the virus itself, specifically if you can catch it more than once. For some answers, we went to a communicable disease expert with the Oregon Health Authority.
This is from Patrick in the center. If I became infected with COVID-19 and recovered, could I become infected again?
The short answer is that we don't know whether you could ever become infected again. We do think that there will be some immunity that may last at least a couple of months after your original infection based on some animal studies, but we don't know how long that immunity will last. And also we don't know whether in a year from now, for example, the virus will have changed enough to evade the immunity that you've developed against your initial virus.
I've heard anecdotally of stories of people in, I think it was in Japan, where a person had recovered from it and then tested positive maybe a month afterward. And there was some question as to whether that was the virus still in the body but not as active, or whether that was a reinfection. Can you speak at all to that?
Sure. We know that the virus can be shed by people who have recovered for a long time, for several weeks. I saw one study that identified it in people who had been infected up to 6 weeks after the onset of their illness. Now, that's not to say that it's still being transmitted at that rate. It's probably there in lower quantity. And remember that we're testing for the genetic material, the nucleic acid of the virus, and not for live virus generally. So we don't know 6 weeks out whether the virus was still living, and we don't know that it's there in enough quantity to infect anyone.
And Simon, so short answer there is scientists don't know just yet?
Well, most experts I've spoken to believe that recovering from COVID-19 does give you some protection against the virus. What's not clear is how much and for how long. And we do have one more question to get to tonight. Coming up tonight at 6, if you're an essential worker and you're in the high-risk population, do you need to keep on working? Some answers at 6.